Hey guys, it's me, Sandra, TTC 45, coming to you with a TTC update. As you can see by the title, it's not a good update, but I also want to make sure I'm keeping you guys informed every step of this journey. So, as you know from the last video, I let you guys know that I was on my way to the OB for my annual exam and to also get a referral to go back to the RE for a possible transfer sometime in the late fall. And the OB gave me the green light to go ahead and have another transfer. Even submitted the referral over to the RE clinic. And when I tried to call the RE clinic, probably about 3 days, 4 days after they submitted the referral, they claimed they didn't get it. And then I called them again, maybe 2, 3 days again later. They still claimed they didn't get it after I had called the clinic, and the clinic said they sent it over a second time. Then the third time I called, they said, "Oh well, yeah, we did get it, but in order for us to make you an appointment, you have to have a chlamydia test done as well as an updated pap smear." Now, granted, I had just had my annual exam. I did get a vaginal exam, but I wasn't sure if he did a pap smear, even though he did use the speculums to do the vaginal exam. So I called my OB nurse and I asked her, I said, "Can you check and find out if he did a pap smear and if he tested me for," I'm sorry, something popped up on my phone, "and if he tested me for chlamydia." And so she looked in there and she said, "Well, no, he didn't do the pap smear because pap smears are only done once every 3 years, and it had not been 3 years yet." And she said they only do chlamydia sculptures or cultures, however way you pronounce it, whenever it's needed or requested. So I told her, well, the RE clinic is not going to schedule me an appointment unless I have those two done. So she scheduled me an appointment to come in. I had to see my OB nurse practitioner because my OB was not available until next month, and I didn't want to wait that long. So I went in to see the nurse practitioner. Now, if you guys recall in the last video, I told you guys that I went to the OB and I was letting him know about the irregular menstrual cycles and the heavy bleeding sometimes, and also the abdominal cramps, which to me is a sign of uterine polyps because I have a history of uterine polyps. And so I brought it to his attention, and when he did the vaginal exam, he did kind of see a polyp on the outside of the cervix, so he wanted to do a ultrasound to check the inside of the cervix to see was there any polyps on the inside of the cervix. So the same day that I went in to do the pap smear, that is also the same day I had the ultrasound. So I had the ultrasound first, and then I went in to see the doctor. So she had already had the ultrasound results when I came up in there. And so when I came in there, she said, based on the ultrasound results, it looked like I have a 2.5 centimeter cyst on the right ovary. And but she thought that was pretty small. There's nothing they need to do about that at this point, and that she don't think that it's causing any kind of discomfort or heavy bleeding. But she did kind of go over my symptoms and my past, and she felt like my OB need to test further. So she went to talk to the OB to see if he wanted to test further, but he was like, "No, we don't need to test further. The vaginal ultrasound picks up anything that's in the uterus pretty good. She all good to go." Okay, so about 3 days later, I think it was. No, maybe, yeah, it wasn't that long. Maybe 3 or 4 days later, the nurse called me and told me that the chlamydia test. No, I'm sorry, I'm jumping ahead. She called me and told me the results of the ultrasound again. But this time, not only did they say they saw a cyst in the right ovary, but they also saw 1 centimeter fibroid in my uterus. Now, I've never had a fibroid before. I've heard of them. I never really did a lot of research on it because I didn't have a reason to. And so I wanted to know more about it. And I'm like, okay, well, what is a 1 centimeter fibroid? She said, oh, it's very small, nothing to be concerned about at this point. And she said that I asked her, well, is it on the uterus, on the inside of the uterus, on the outside of the uterus, left side, right side? I said, these are things I need to know because he know I got a schedule. Well, I don't have a schedule, but he know I'm trying to get another transfer. And that'll be coming up soon, so I need to know, more about this fibroid. She's like, oh, well, I'll ask him and then I'll get back with you. So she called me back the next day and she told me that he said it was very small, that it was on the uterine wall but not in the lining, so it shouldn't interfere with any transfer. And she did never ask him was it on the left or the right side. And I asked her, I said, okay, so is he going to test me further? I'm like, I'm still trying to figure out what's causing, the heavy bleeding and the cramps and the other stuff that I'm going through. And she called me back again because whatever I asked her, she would go ask him. And she called me back and she was like, well, he said that those are part of being in perimenopause. You're going to have abnormal menstruals. You're going to have longer menstruals than normal. And you're going to have more heavier bleeding. And with the heavier bleeding, it's going to come more intense cramping. I'm like, okay. So I let it go. And then a couple days after that, I got the results back from the chlamydia test, which I knew that was negative because I haven't even been sexually active. And then now it was all about waiting for the pap smear to come back because, remind you, my RE clinic would not schedule me for an appointment unless I have an updated pap smear. So it was a week later when I got a call from the nurse of the nurse practitioner who did the pap on me, and she called me to tell me that my pap smear was abnormal. And I wasn't, nervous about it, or I mean, it didn't bother me or anything that it was abnormal because of the fact that this is not the first abnormal pap smear I've had. I've had multiple abnormal pap smear when I was younger. It's been a while. I mean, it's been a while. It's been well over 10 years since I've had my last normal pap smear, abnormal pap smear. So I know the routine to that. Typically, they either have you to come back and test again in a year, or they do what they call a colposcopy, where they go and biopsy the cervix and the uterus and send it in to check and make sure that it's not full-blown cancer or anything. And I've had all of that done when I was young, so that wasn't nothing that really surprised me, only a little bit, because the fact that I had, for the last 10 plus years, I've had normal pap smears. Now I'm going back to having abnormal pap smears. So when she called me, I had already sent an email to the OBGYN earlier that day to let him know that I had just started my cycle. And not only did was the cycle heavy, but I felt like I was just hemorrhaging. I was hemorrhaging so bad. I mean, TMI, I bled through everything, like totally everything. And I actually took pictures of it and I sent them to her. That's one thing I like about the email on the medical portal, is that you can send doctors pictures. So I sent him pictures and I let him know, hey, this is my first day of my cycle and this is what happened. And I said, now I know that, because I did, read up on it. I do know that when you go through perimenopause, it can cause heavy bleeding. It can cause, delayed periods, missed periods, all that other stuff that I was having. I said, but this is really bad bleeding. Not to mention, I was having really bad cramps. I mean, the cramps was just off the chart. He had his nurse to respond to me by email once again, blaming it on perimenopause. And this is the part I hate about doctors, is that they always never look into when a person is trying to tell them the stuff that's going on, especially when it comes to black people, black women, black men, whoever. That's why we die more faster than other races, because when we try to go and we complain about things that's going on with us, they don't take that stuff serious. They just, say, 40 years old, having this, having that. Oh, she's going through perimenopause right now. They treat the symptoms and not the problem. They don't even try to look into it and rule out anything else. Try looking into it first, then rule out, okay, well, maybe, we've tested you for this, we've tested you for that, then this has to be perimenopause. Everything came up negative, So he wasn't trying to see me again or nothing. He just brushed it off as perimenopause. And so when she sent me the email back the first time, say hi. Y'all know who this is. When she sent me the email back the first time, I responded back to the email and I said, okay, I guess this also is the reason why my cramps are so bad too. And so I'm assuming by the time they got the second email, he had then got the word that my pap smear had came back abnormal. And so at this point, a red light, ding, 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 maybe we do need to get her in here and figure out what's really going on. So then she emailed me back and asked me if I can come in next week so that they can do the colonoscopy, and I told her yeah. And so I'm going in next week to do the colonoscopy. Now, like I said before, I got a little setback with this whole ordeal because even though I'm not really nervous about the fact that I got an abnormal pap smear, I had to go back and think. The whole purpose of me getting the pap smear is because the RE required it. So I'm thinking to myself, okay, if I got an abnormal pap smear, does this mean they not going to treat me? They not going to make me an appointment to come in? So I start getting nervous, and I was trying to look somewhere on a website, search somewhere on Google, anything to find out if doctors don't treat women who has abnormal pap smears. I just started getting nervous all the way around. And so then I remembered that I belonged to a group on Facebook that patients of the same fertility clinic that I go to, they got a group page for the patients that go to their clinic, and I went on that group page and I asked any of the ladies, have they experienced, what I was going through? Have they ever had a pap smear that was abnormal and was not able to continue with treatment? And I had one lady respond to me, and she told me that she all of her pap smears have come back abnormal. She have never had a normal pap smear, and she said that that did not stop my clinic from treating her. She stated that in fact she's had several treatments that turned into pregnancies and live babies, even while having an abnormal pap smear. She said her doctor just had to let them know that she had a history of abnormal pap smear. So I was so glad to hear that, because that finally put my mind at ease. But I wasn't totally at ease until I hear from the horse's mouth. So the next day I contacted my clinic. I was honest with them. I let them know I had an abnormal pap smear, and I wanted to know if that was going to delay my treatment. What do I got to do next? Or, what is it that needs to be done? And she put me on hold while she spoke to a nurse, and the nurse told her that I can continue with treatment as long as I get a medical clearance from my OB. They won't stop me from getting treated. I just have to have a medical clearance. So that made me feel much better, knowing that this is not going to interfere with that. Then, because of the fact that I was still having these real bad cramps, and I was still having this really, really heavy cycle, I decided to do some digging um, on the type of precancer cells that they found on my cervix, which was what they call what they call it, low level some lesion. I forgot. It's like a abbreviation for it, and I forgot what the abbreviation is. But anyway, I went to look that up, and it was saying, about 10% of women who was diagnosed with that, only about 10% or less end up with actual cancer. And of those 10%, most of them that end up with cancer are the ones that had a history of abnormal pap. And so I started getting nervous then, because at first I wasn't nervous because I've been through this before. But then I started getting nervous. Not only did it say um, history of abnormal pap, but it also stated that the ones that usually that develop into real cancer are age 35 and up. I was like, oh geez. So I started getting super duper scared. It's like super duper scared. And then I continued to read on, because in the past I never went and read up on abnormal pap, because like I said, when I've had abnormal pap, they've either repeated it and it was normal, or they did a colposcopy and they didn't find anything, and then later on I had a normal pap. So it was never nothing to research on. This time I'm getting a little nervous here, because I have a history of it, one, even though it's been a long time, my age too, and then somehow I came across the signs of cervical cancer. And when I went and looked at the signs of cervical cancer, I could not believe my eyes. The signs of cervical cancer is what? The same signs as perimenopause: abnormal periods, severe cramping, heavy menstrual, and delayed menstruals. Everything that I'm going through. Now, in the past, I wasn't going through this stuff. But, of course, in the past, I wasn't 48 years old neither. So, now I'm nervous. I'm trying to keep a positive attitude, because, like I said, I've been down this bridge before. And I'm trying to keep a positive attitude, but it's very hard to keep a positive attitude when you're having symptoms that's going along with the diagnosis. Now, granted, nothing is written in stone until I've had further testing, and the further testing clears everything, which I'm hoping, wishing, and praying it does. But I have to admit, I have a really high anxiety at this point, because I don't know what the results may come back saying this time. I do know that something has to be wrong for me to have really bad cramps and really heavy menstruals. I don't know anyone who have gone through perimenopause and have had what I'm going through. I mean, I've heard of, abnormal menstruals. Gotta keep my eye on her, because she be always getting into stuff. I've heard of abnormal menstruals. I've even heard of missed menstruals. I've heard of a lot of things during perimenopause, but no one has told me about the heavy bleeding along with the really bad crampers. So if any of you ladies out there who either are going through perimenopause or have been through perimenopause and have had some really bad side effects from that, please enlighten me. I need as much as enlightenment as I possibly can. I need somebody to tell me that what I am going through is absolutely normal. I need somebody other than my doctor to tell me that, because my doctor is only telling me what he know from what he read in books. This man is not a woman, okay? He is only telling me what he has learned from books he have read when he went to school. Okay? He is telling me what he have seen from patients he have treated over the years. Remind you, this man is, I think we the same age, or I may be a little bit older than him. But I need somebody who has actually went through this ordeal to not call me, DM me, message me, put a comment, whatever, and let me know that what am I going through is normal. Because between now and next week, when I go have that colposcopy and also waiting for the results to come back, I'm going to be a nervous wreck, because I'm going to be afraid of what those results is going to show. I just want everything to be okay. I just want everything to be okay. Right now, there's a little bit of a delay with me starting my treatments for the second transfer, which I wasn't planning on doing that until October anyway. But I wanted to make sure that I was all clear, which is why I started now. And I still don't think I'm all clear. I still believe that they should do further testing to make sure I don't have any polyps. So if my OB don't want to do it, that's fine. I ask my RE to do it. I ask him to do a water sono and just clear my mind and make me understand that there's nothing going on in there, that everything is just a fictive fiction of my imagination. It's just perimenopause. But right now, I am asking you guys to pray for me. Pray with me that when I go and have this colposcopy, that it come back benign. There's nothing going on. I can live life happily ever after, because I still have a little baby Pebbles that's going to need her mama as long as she can have her. And I am not about to let cancer destroy me. So that's all I have for you guys. I just wanted to give you an update to let you know that I have not started my treatment yet. I had a little setback, but I'm going to bounce back, and this treatment is going to get started sooner than later. I am going to keep you guys up to date every step of the way. Hold on, she's tearing up my plant. Stop, little girl. Stop. I'm going to keep you guys updated every step of the way, let you know what's going on. And whatever I hear, you guys will be the first. I still want you guys to pray for me. And together as we pray, those results is going to come back fine. I'm also praying for you guys. I'm praying for your journey. I'm praying for the peace in the heart. I'm praying for the healing. And I'm praying that you ladies get your babies this year or next year, or whenever God has prepared that for you, whether it be through an IVF, natural, adoption, however way you get it. I'm just praying for everybody, standing in with this fight with you guys. And I haven't had any new positive pregnancies that I so far out of all the ladies I've been following. So, but Sticky Baby does to those who are still in that fight. Okay, ladies? Thank you.